Hey there, welcome everyone to this presentation on developing therapeutic tools for couples. I am Cecilia Dunn, a National University student and your host for this workshop. So, here is what we will be discussing today an introduction to couples therapy workshop. We will go over the male and female sexual response cycle, which I include three parts for that: the emotional aspects of sexuality, definitions of sexual dysfunction, inaccurate definitions and perceptions of intimacy and sex, the application of these concepts and principles in the sexual interactions, and how these tools may vary when working with gay and lesbian couples, followed by a summary and my references. So let's begin. So, again, hello everyone, and I want to welcome you to this virtual presentation workshop. I am so delighted that as a couple you could join this informative workshop on therapeutic tools for couples. In today's presentation, we're going to delve right into important aspects of sexuality in intimate relationships, as well as learn about sexual responses and how they affect men and women alike. This presentation is designed to provide valuable insight into the human sexual response cycle and helpful resources for couples who are seeking to enhance their understanding and in experiencing better sexual health. So let's get started. What is the sexual response cycle? When an individual becomes aroused or is participating in activities that are sexually stimulating, the response cycle, there are many physiological and psychological and emotional changes which take place to prepare the body for this stimulating experience. Sexual stimulation can set off the sexual response cycle not only in intercourse between a man and a woman, which is penile and vaginal sex, but also in sexual intercourse between same sex couples and sexual activities such as manual stimulation of the genitals or a sexual partner, um, oral sex, or sharing sexual fantasies with a partner. Early physical studies of the sexual response cycle were conducted by William Masters and Virginia Johnson, who created a standard model. The sexual response cycle model was created to scientifically explain how the human body responded physiologically during sexual arousal. In understanding the male and female sexual response model, we explore the first model used. In the first sexual response model, there are four distinct phases of the sexual response cycle, which include excitement, plateau, orgasm, and resolution. While Masters and Johnson were the first to create the first model of human sexuality, we find that in the past 60 years, other researchers have studied sexuality and the sexual response cycle. Some of them have been skeptical of the first model and have added different aspects to it, as an example of changes made in the sexual response model when therapists added desire to the model as a way to define what causes arousal. Masters and Johnson's model reflects a linear path of the sexual response cycle, which begins with excitement and ends with resolution. This model has been accepted in explaining the sexual response cycle for men, but it has not been found to be very accurate in explaining the female sexual response cycle. I will explain why. You see, for women, Masters and Johnson's sexual response cycle is more relevant in the beginning of a relationship. However, researchers found that as a relationship continues into the long term, it can most likely be that women look for the reward benefits of seeking sexual stimulation. And some of those reward benefits could be to please their partners and to feel emotionally close to them. But they also it also could be to attain sexual stimulation as well. Sex for women is complex, and women may be affected by many psychosocial and internal factors. For women, the sexual response cycle may reflect a linear cycle, but it also can be circular, ending with a previous phase rather than orgasm or resolution. For women, orgasm is not always the end goal, but is perceived as a way to increase emotional intimacy and less of a biological, spontaneous occurrence. So let's go over the first sexual response cycle model. In the excitement phase, it's described that men and women alike will experience an elevated heart rate and a rise in blood pressure. Furthermore, there will be an increase in blood flow that will begin to course towards the genitals, and this is called vasocongestion. For men, this increase in blood flow will cause an erection in the penis. Um, when women become aroused, they will experience vaginal lubrication as well as swelling in the labial majora and breast swelling. Both women and men alike will notice that their nipples become erect in this phase as well as muscle tension. The plateau phase is a phase achieved when powerful rushes of sexual excitement and pleasure continue and to grow and become more intense. For men, their testes will pull up towards the body, and they may experience a feeling as if they are going to ejaculate soon. For women, they will continue to experience vaginal lubrication, and actually, the uterus becomes elevated, and the inside of the vagina, women will experience engorgement and a change in vaginal color due to the increased blood flow. The clitoris becomes sensitive to touch, and for both women and men, they will experience an increase in sensitivity to stimulation and an increase in pelvic muscle tension. During this phase, the sexual response cycle may lead to orgasm. The orgasm is the most intense phase, yet it is also the shortest phase. Both men and women will experience rapid breathing and involuntary muscle contractions, which in some cases can contract in other areas other than the genitals. Women will experience vaginal and cervix muscle contractions, while men may experience muscle contractions in around the penis, causing semen to be ejaculated. Both men and women may experience flush skin during this phase, and for women, they can experience multiple orgasms can be achieved at this stage. In the resolution phase, the body returns to its normal pre-excitement state. In this state, it's more about recuperation, where the body returns to a relaxed state due to the release of endorphins and hormones. For men, it would be more noticeable to see that there is no longer any engorgement of their genitals, such as the penis returning to its normal size. The uterus returns to a lowered position, and men will likely experience a refractory period where they are unable to become sexually aroused for some time, and this can last for a few minutes to several hours. Women do not enter this phase as stated in the previous stage. They are capable of achieving multiple orgasms and recovering quickly. So, what are some emotional aspects of sexuality? Research from Masters and Johnson found that sexual communication helped couples to have more fulfilling sexual relationships. Newer studies have found evidence that emotions can affect sexual responses, such in a research study that found a direct correlation between having a positive state being and the activation of sexual responses in men. But for women, on the other hand, a positive emotion is not solely correlated to sexual responses, meaning that just having a positive emotion alone is not going to cause women to become aroused or excited. For some women, certain emotional states, such as touch and conversations, can spark a desire and arousal in the body. Now, arousal is an emotionally driven reaction that occurs as a result of sexual stimulation. When women feel that they have a positive bonding experience with their partners, such as having a healthy level of sexual communication and a feeling of connection, it can go that goes beyond sexual activity, it can increase the chances of having favorable sexual experience. Emotional bonding is also felt after reaching orgasm due to a release of certain hormones such as oxytocin and dopamine, which are thought to be hormones that promote a feeling of relaxation and closeness. Research also indicates that emotional aspects that affect sexuality suggest that women can be affected most by stress and depressing emotions, as these emotions can discourage the sexual response and have often been reported in cases where women had sexual disorders. Overall, negative emotions are present in sexual disorders. So let's go over some accurate definitions and perceptions of intimacy and sex. So, what is intimacy? Intimacy is our ability to get close to another human being by sharing the deepest parts of who we are with someone else and allowing ourselves to be vulnerable, showing someone that we want to understand them and yet to be understood. Furthermore, intimacy is about building trust in another person, respecting and accepting who they are, and finding that a level of responsiveness reciprocated. In emotional intimacy, individuals may feel a connection and level of closeness experienced between the two individuals. Now, in going over the accurate definitions, I wanted to go over a myth about intimacy. You may have thought intimacy is sex, and it is not true. A person can have sex without intimacy. As an example, when they are engaging in masturbation or having a one night stand with someone, in the same way, a person can be intimate with another person without engaging in intercourse, such as spending time together, learning to connect. Why is intimacy important? Intimacy is very important in a relationship for many reasons, including that it emotionally connects us to another person and can be extended to include intercourse. Enhancing a physical and emotional connection can enhance one's desire for sexual stimulation. Sexual activity, um, sorry, I had that word thrown in there. What is the human sexual response? The original sexual response included the four phases, which were excitement, plateau, orgasm, and resolution, and each phase included an array of physiological changes, but also had emotional and physical and even interpersonal states. Sexual preferences and experiences influence the human sexual response cycle. Some accurate definitions you need to know to understand more about this includes knowing what sexual intercourse is. It's an action that takes place between two people and can be between a man and a woman, which is called coitus, or it could also be between two women and two men, or non gender identifying individuals as well. Sexual desire is a cognitive process. The other phases in the sexual response cycle are physiological responses, which act as automatic processes that occur in the body. Desire is a subjective response that can be spontaneous or take some work. A medical condition such as a decrease in hormonal levels or heart disease can cause sexual dysfunctions. Additional causes are medications, psychological factors, and even aging. Another one could be a traumatic sexual experience, such as having a negative sexual experience, like sexual abuse. Sexual dysfunctions can make it difficult to get close to one's partner as well. Sexual orientation. This refers to the component of a person's identity that shapes what they see as romantic as well as what they find sexually attractive. I wanted to go over some accurate definitions for sexual dysfunctions. Looking into the DSM 5, we find that sexual dysfunctions are defined as being a clinically medical significant ailment that affects activity or the ability to perform sexual activities, and may find that the person is unable to fantasize about sexual activities or sexual scenarios, or the inability to engage in a sexual activity altogether. This inability to perform sexuality at any phase in the human sexual response cycle may occur if a sexual condition is present for, longer than like 6 months or more. For a sexual dysfunction to be diagnosed, the individual must have several symptoms present, and it's usually debilitating and hard for them to live with. So, one of them I wanted to go over was erectile dysfunction, which is the inability to achieve or keep an erection during sexual activity. In women, it's kind of defined differently. It's a female interest and arousal disorder. Women would experience a complete inability or reduced ability to become aroused and a reduced ability to fantasize about sexual activities. Other dysfunctions can include one or both partners avoiding sexual activity, or developing an aversive feelings about having sexual contact with one another. Anorgasmia is an inability to reach an orgasm. Um, there's also disorders that can cause pain during sexual activity as well as premature and delayed ejaculation. In applying these concepts and principles in sexual interactions, it's important to understand the human sexual response cycle and how it affects each person. By understanding the self through psychoeducation, couples are able to identify where and possibly what phases of the sexual response cycle they are having difficulties in or dysfunctions occurring. Sexual communication, as I spoke about before, couples need to try to increase their level of intimacy and sexual communication. Sexual communication involves feeling close and secure enough to share one's preferences of sexuality and the willingness and desire to engage in sexual activities as well. Engaging in sexual communication is so crucial for sexual satisfaction because everyone's sexual preferences may differ, as well as a desire to engage in sexual activities is likely to change over time. And in cases where one partner is struggling with a low level of desire, it's crucial to communicate that with their partners and to work to problem solve the situation, as much as they can, which means some couples have to really learn how to communicate more effectively. And one step to applying these concepts is to become aware of one's body, taking a biopsychosocial approach, which allows a clinician or physician to assess and examine the psychological, biological, and medical history and relational influences on that they've had on the individual sexuality. Psychoeducation can help couples understand what is occurring based on their diagnosis and offer a comprehensive communication skills training. It is important to engage in therapy as a couple and using sex therapy, mindfulness based cognitive behavioral therapy approaches can help clients with sexual dysfunctions and emotional regulation issues, especially in changing existing thought patterns and unhealthy beliefs that can really hinder intimacy and sexual communication. Other reasons couples may seek therapy could be that maybe an individual needs to work through issues that are not allowing them to sexually express themselves, such as being the victim of sexual abuse or trauma. Victims of trauma can really benefit from sensate focus, which can help couples to learn to no longer have fear or anxiety about touch or sensations. Sensate focus is a therapy that can be offered in person but also online. The work would include applying various touch exercises found in videos or audio. Sensate focus therapy can be used alone or in conjunction with couples therapy or sex therapy. As an example, Blue Heart is an online therapy found on an online app that can be found really easily on your phone, and it allows users to apply sexual exercises and therapy at home so that they no longer struggle with the embarrassment or shame in reaching out to a therapist in person. Treatment may require pharmacological approaches, which is medication, in cases where one partner is experiencing medical issues that affect their ability to engage in sexual activity, such as loss of hormones due to menopause or the presence of pain. How these tools may vary when working with gay and lesbian couples. Well, in examining cultural differences, there are societal attitudes, cultural norms, and religious beliefs that continue to play a role in what is acceptable in sexual expression. Secondly, individuals who are part of the LGBTQ population may experience feelings of shame and confusion about their sexuality, especially before they have come out, which can affect how they feel about expressing themselves sexually. Looking at individuals from LGBTQ populations, research shows that they may face mental health conditions and attain medical conditions as well, which are caused by stress and anxiety. Without the proper tools and approach, individuals from this population can face emotional and physical intimacy problems. LGBTQ couples need a therapeutic approach that is supportive in environments where gay and lesbian individuals feel safe to be sexually expressive and be themselves. Their relational satisfaction can be compared to that of heterosexual couples, though findings show that gay men may engage in sexual activities at a higher rate compared to heterosexual men, and lesbian couples do not engage in sexual activities as much as heterosexual women, but report higher levels of sexual satisfaction than heterosexual women. LGBTQ couples in general have high levels of intimacy, and they believe that it's because they may lean on each other for emotional support. Various resources to use in this population are to find an LGBTQ support group that supports same sex and transgender couples, to attend couples therapy with a therapist that specializes in helping same sex couples. In this presentation, we have examined what the human sexual response cycle is and its phases. We have explored how There is an emotional connection to sexual intimacy and how intimacy can affect a relationship. We have discussed how to apply the terms learned and to enhance your relationship and intimacy level. We have looked at what tools and resources couples could look for in trying to work through their relationships and in overcoming sexual dysfunctions. I hope that in being part of this presentation workshop, couples have gained a deeper understanding of what is involved in the human sexual response cycle, what couples can do if sexual dysfunctions are occurring, and how to have a healthy relationship going forward. Thank you for your time, and this concludes this presentation. Here are a listing of some of my references I used. Thank you, and goodbye.